I want to share with you now the experience about how the Exufiber in some situations may protect you against the reformation of the biofilm. Of course, we need to look to the patients and understand that if you have clinical signs of infection, and sometimes when you're using some specific materials, they don't give you the answer that you need. And if you have signs of infection, you need to clean quite well, you need to use antiseptics, you need to debride as soon as you can, as much time as you can, and then probably you need to decide to use a topical antimicrobial, like for example, silver, that simultaneously of absorption can release the ions of silver in the wound and cover you the risk of biofilm formation. That's why in this situation specifically, I started to use the Exufiber AG, where I need to adapt and put inside of the cavity the ribbo of the Exufiber AG. But of course, you need to make cautious because this should not create pain to the patient. So you need to insert there. It was really deep, the cavity that we had there. So we inserted the ribbo inside, and simultaneously what we have, we know that to release the ions of silver, you need to have exudation. So that's why I put the ribbo inside, and then the exudation absorbed and transferred to the secondary dressing. And of course, after 1 week of treatment, so just 2 treatments between 3-4 days of dressing change, what you see immediately, it's a change of the exudation status. It's really important to evaluate it quite well. You need to evaluate the skin, evaluate the tissues, and also the borders of the tissue. But I always say, learn with the dressing. And if you look carefully to the dressing, you see that the exudation status changed. And if you look to the wound, you don't have inflammation response so heavy, and also increase of healthy tissue. So that's why my decision went to using silver ions on that situation, because we could clean, we made debridement, we prepared wound bed, and the time frame to use antimicrobials topically was used on the correct time. So the silver was released inside of the cavity, and we could at least protect against biofilm formation, at least in a clinical perspective. This clinical case about preventing biofilm shows us like a leg ulcer. It's really normal, about 6 weeks of evolution with refractory to any kind of treatment. We see that we have slot, we see that we have heavy exudation over there, we have odor, we have pain that the patient referred to us, and we need to clean quite well and prepare the wound bed. That's why I cleaned, I used antiseptics, and then I used the Exufiber AG, because I wanted to allow simultaneously of the absorption of the exudation, it will release the ions of silver. And we see quite well here that after removing the first part of the dressing, you see that it's completely saturated the Exufiber AG, so it made what it was supposed to do, and you can see quite well the reduction of edema. You see you don't have the same smell that you had before, you have less pain, and in the minimum, you can see that there's no evolution of infection. If you look carefully to the tissues, there's no maceration. Even if you look deeper, as you can see here, you see that's a good evolution of the tissue. So you stopped the evolution to a negative phase of infection. You could promote at least protection against biofilm formation. This case, again, about preventing biofilm, it's a really hard one because you have a dermatitis associated with an uncontrolled exudation associated with the use of a wrong dressing. But as soon as I started to use Exufiber AG, we could manage and control the transfer of fluid to the secondary dressing. And you can see here, look to the skin and you see immediately that you have a reduction of inflammation. Even when you look to the tissue, to the wound bed, you see there's really changes. If you look to the dressing, you see that it was able to absorb, it was able to control the exudation and transfer to the secondary dressing, and simultaneously change the wound bed would tell us that probably there was an autolytic debridement associated, and there was a release of silver that reduced the impact on the biofilm formation, and of course reduced the signs of inflammation and infection. That's been a great experience for me and for my team when we started to use the Exufiber. That's why I will continue to use, because I have a product or a technology that helps me to control the amount of exudation, helps me to transfer the fluids in a cavity to a secondary dressing, simultaneously gives me the moist environment that I need to promote autolytic debridement, and in the end, if I use the AG technology, I have the capacity to simultaneously deliver silver ions in the wound bed and try to promote or protect against the biofilm formation in the window of opportunity. Thank you very much for your time.